Hi, I'm Marissa Galicia-Castillo, and I thank you for inviting us to speak to you all about the emerging threats to the U.S. macroeconomic stability. What we'll be doing today is looking at two specific emerging risks to our macroeconomy, as well as those effects and policy recommendations on those two topics. So the two emerging risks we'll be focusing on are first, political debt ceiling, and then the healthcare bubble. So let's talk about the debt ceiling. The debt ceiling is the legal limit on the amount of borrowing that the Treasury can do. Before 1917, Congress had to authorize any loans issued by the Treasury, and this was well regulated. The federal government is currently running a deficit, and this simply means that the government is spending more than it collects in revenue. And because of this gap, there's a need for loans and there's a debt. The issue is that when not only are there loans, but there's also loan interest on those loans, which then also increases that debt. Now, the lifting of the debt ceiling allows the U.S. Treasury to borrow even more. And in our current atmosphere, we see this in politics where people want to increase that debt ceiling, but that becomes very, very contentious. In the One Big Beautiful Bill Act, Congress raised the debt ceiling by $5 trillion up to $41.1 trillion. As you can see, the current national debt is about $37 trillion. And this has become very much an issue. Now, if the Treasury hits the debt ceiling, the United States was to default on its debt, that would result in significant financial instability and loss of investor confidence. This could trigger a stock market decline and potentially increased interest rates. When we look at three areas, the economic uncertainty could certainly lead to a decrease in output, an increase in unemployment, and an increase in interest rates. So looking at an aggregate demand, aggregate supply model, it shows us that if a default in debt occurs, we would see a leftward shift of the aggregate demand curve. That would then show a disruption of financial markets, an increase in borrowing costs, and overall uncertainty that can lead to a decrease in overall economic spending. So what do we recommend? As a fiscal policy, stop allowing an increase in the debt ceiling. This is much easier said than done. It is quite challenging, but we need to work on decreasing that debt. And truly the main ways of doing it is by increasing revenue to cover that debt, which from a government standpoint will mean increasing taxes, and decreasing the amount that is being paid out or what is being spent. And what that translates into is a decrease in benefits. This is certainly not very popular, but needs to happen in some way, shape, or form. Now, ideally, this needs to be done incrementally. And some examples include increasing the age to obtain government-supported programs, such things as Medicare and Social Security. As you can see, maybe increasing taxes. So let's look at the tax side and perhaps focusing on specific taxes such as sin taxes. These are taxes on cigarettes or alcohol or other products that may contribute to unhealthy behaviors. And on the flip side of that, perhaps we would have more tax credits, looking at health habits, weight loss or disease control, or caregiver work. These are all things that will be helpful to our constituents and hopefully could be a good balance. Other areas could include supportive social determinants of health, and as again looking at weight loss and disease control, try to decrease that chronic medical conditions. One other aspect could be support of improved end-of-life care, and that's to support families and decrease use of inappropriate treatments. All of these things that lead to increased spending and debt. And that will be further discussed in the second part of this presentation. Because we are going to talk about healthcare and potential healthcare bubble. So the United States currently spends about twice the average of other developed countries in per capita healthcare, about $10,209. However, despite this, as you can see from the schematics, our health outcomes are not any better than other countries. So what's going on? Potentially medications. There are higher prices for drugs as we don't have the ability to negotiate prices compared to other countries. Spending grows about 6% per year. When you look at healthcare spending in 1990, it was 12% of the GDP. By 2025, it's expected to increase to 20%, and these costs continue to rise. The Affordable Care Act insured more people, but it didn't address the primary cost drivers, so costs were not controlled. Other issues, financialization. We're seeing private equity firms that are acquiring healthcare entities, and the incentive is on profitability, not necessarily patient care. We've seen this even more recently with nursing homes and hospice agencies. Employers who support health plans for over 160 million Americans are no longer able to sustain the rising costs. These costs decrease their profit margins, and we're seeing more out-of-pocket expenses as the cost sharing is becoming less and less. This simply is unsustainable. So these high costs of medical treatments and prescription drugs, there's a lack of price regulation and negotiation power for programs such as Medicare, and healthcare providers charge very expensive rates. Second, the fee-for-service payment model that truly incentivizes overutilization of services, procedures, tests, treatments, without a lot of evidence of improving patient outcomes. We need to see more value-based care. This is where providers are rewarded for improving health outcomes. But one of the issues is that's quite difficult to measure. And another aspect, third aspect, is excessive administrative costs. 34.2% of total healthcare expenditures compared to Canada is 15.5%. Care is fragmented. We've got multiple payers, different providers, all of this results in billing error, duplications. There's no unified electronic medical record, so there's further fragmentation of treatment and care and more redundancy in testing. So what happens if this healthcare bubble bursts? So this certainly has effects on output decrease, unemployment increase, and increase in interest rates. So when we look at the aggregate demand, aggregate supply model, we would have effects on both sides, both the demand and supply sides. Now, if the bubble bursts, that would impact cost and would shift the short-run aggregate curve, and would shift it to the left, and that would raise prices and lower output. And as noted in the slide, the unemployment increase and interest rate increase. So what are some of our recommendations? There needs to be value-based care, as mentioned. Part of this is streamlining the administrative processing, such as billing, which is extremely complex. So the recommendation is move to that value-based learning, change aspects to Medicare in particular, and then change E&M, evaluation and management billing, to better reflect that type of care. We should also look at limiting private equity firms' healthcare acquisitions, as the incentive is not necessarily healthcare and maybe something different. Other areas for value-based care, again, supporting health-focused behaviors, as mentioned previously. Look at more preventative treatments so that we don't have as high of the acute care costs, and support improved end-of-life care. So what does that look like? Here's some examples. Perhaps, as mentioned before, having tax credits for for a healthy lifestyle, looking at diet, weight, exercise. And as you can see in this schematic, right now, most money is spent in acute care. What we would propose is let's move towards increasing preventative care and palliative care to help really reduce those costs. And acute care, just based on this environment, would become less and less. So these are some of the ideas we have, and appreciate all of your time and allowing us to present to you. Thank you so much.